Hi guys, this is Dr. Chang from Blooming Family Dental, and today I want to talk to you guys about sleep apnea and its prevalence in patients with cleft lip and cleft palate. So I believe I bring a unique perspective to this topic because I'm a dentist that treats sleep apnea, I'm a patient that has sleep apnea, and I also have cleft lip and cleft palate. And studies show patients with cleft lip and cleft palate are 5 times more likely to have sleep apnea than the people who don't. When I was younger, I would always ask my dad and I would wonder, why am I always tired? I would fall asleep in school a lot, I would fall asleep in church. It wasn't clear to me why I would be always having low energy and always feel the need to fall asleep. And when I became a dentist, I heard a lot of talk about sleep apnea, how dentists can be the ones that screen for sleep apnea, help the patients get diagnosed, help the patients get treated with an oral appliance which has much higher compliance than a CPAP mask. And this was all very interesting, but I never really got into it until I found out my dad has severe sleep apnea and he had been prescribed the CPAP, but he refused to wear it because it was very uncomfortable for him. And I learned more and more that the sleep apnea can cause things like hypertension, diabetes, Alzheimer's, and that it can also cause you to fall asleep when you drive. I had gotten into a couple of car accidents because I had fallen asleep driving long distance. And so my dad was the reason why I got into sleep medicine, because I wanted to make him an appliance that he could comfortably wear and breathe better, sleep better, and be more healthier for the rest of his life. But when I was at the sleep course, I always suspected that I could have sleep apnea, although I didn't fit the stereotype of someone who has sleep apnea because I was young. I was in my 30s and I was relatively fit and I didn't snore. But I got a sleep test done anyway and found out that I had an AHI of 17 and I had moderate sleep apnea, which was a surprise for me, but explained a lot of things as well. I immediately got started treating myself, and it was hard because patients with cleft lip and cleft palate are not the same when it comes to oral appliance therapy. We have limited lip competence, which means when you wear an extra appliance in your mouth, it's very hard for us to put our lips together. So I had to use multiple different devices and find the one that works for me. When I started using the appliance, it really changed my life. I had much more energy, I didn't fall asleep in church, and I felt like I woke up for the first time in 31 years. I was excited, I was very happy. At the same time, I was a little disappointed. All the doctors and dentists that have helped me along the way with the surgeries and treatments, none of them had told me that I would be at a high risk for sleep apnea. So my goal is to raise awareness. If you have any questions about sleep apnea, cleft lip, and cleft palate, please feel free to leave the comments down below, or you can email me at theodorechangdds@gmail.com. Please spread the word if you know anybody that has cleft lip or cleft palate, something they could really benefit from, both in their productivity during the day, in their work, with their family, and also with their health.